Hello everyone. Welcome to another episode of Bone Doctor. Today I'm going to discuss an important topic of anterior cruciate ligament injury. Now let us understand what is anterior cruciate ligament. It is a very important ligament of the most important joint of our body, that is the knee joint. It is a ligament which connects the tibia bone with the femur. Why it is called anterior cruciate ligament? Because there are two ligaments in our body, important ligaments. One is anterior cruciate ligament, another is posterior cruciate ligament. Why it is called cruciate? Because it is in an X-shaped or a cross-shaped fashion inside the knee joint. The anterior cruciate ligament starts from the anterior end of the tibial spine and attaches itself to the posterior aspect of the femur. And the posterior cruciate ligament starts from the posterior aspect of the tibial spine and attaches itself relatively anterior aspect of the tibial femoral condyles. So what is the function of these two cruciate, or specifically what is the function of the anterior cruciate ligament? Anterior cruciate ligament prevents anterior translation of the tibia bone over the femur. In one word, it stabilizes the tibia bone over the femur. We know knee joint is a very important joint of our body and it is very mobile. In spite of its mobility, it needs a certain amount of stability for the knee joint to function, because the knee joint carries the weight of the whole body. So if it is not stable, the knee joint will give away and the person will experience falls and instability in his knee joint. So anterior cruciate ligament and the posterior cruciate ligament both gives anterior posterior stability to the knee joint. So the integrity of the anterior cruciate ligament is very important in functioning of the knee joint. So how is the anterior cruciate ligament injured? Whenever there is a sudden torsional force or a rotational force over the knee joint. For example, when a person is playing football or basketball, or he is running at a very fast pace and he suddenly changes direction, there is a rotational force of the femur over tibia. During such rotational forces, if the anterior cruciate ligament is not strong enough, or if the muscles are not well conditioned, there is a high chance of the anterior cruciate ligament being sprained, partially torn, or completely torn. This is the most common mechanism of injury to the anterior cruciate ligament. Some other mechanisms are if there is a road traffic accident, if there is a car accident and the dashboard hits the knee joint, or there is direct injury to the knee joint. These are certain other modes of causes of anterior cruciate ligament injury. What are the symptoms? What will happen when an anterior cruciate ligament is injured? First of all, there should be a loud popping sound, something which is tearing or something which is being torn inside the knee joint. A feeling of something being torn inside the knee joint will be felt by the patient himself, and it will be so loud a sound that the patient can hear that sound during that accident or during that playing or turning motion. The patient may feel immediate swelling and immediate pain in the knee joint. It should be such a severe pain that the patient might not be able to stand or walk on his own. In rare cases, after ACL ligament injury, the patient develops swelling and pain of the knee joint after a few days, that is 1 to 2 days. But in most of the cases, if the full ligament is torn, there is immediate bleeding and hemarthrosis of the joint and the patient cannot move his knee joint, and it is even difficult for him or her to walk. When ACL ligament injury becomes chronic or remains untreated for long periods of time, the patient experiences giving away of the knee. That is, the knee joint seems to give away. That is, it seems to be unstable. When a patient wants to walk, he feels that his knee joint is going out of place. That is the most common symptom which is reported by ACL ligament injury patients. This is the symptoms which is experienced by ACL ligament injury patients. What are the complications of long-term ACL ligament injuries? Or if we keep the ACL anterior cruciate ligament injuries untreated for long periods of time. As the knee joint becomes inherently unstable due to presence of ACL tear, there is also injury to his other ligaments, that's the posterior cruciate ligament, the meniscus, etc. If it is kept for years on end, that is 5 years or 10 years, the person or the patient develops arthritis, deep arthritis and of the knee joint, and the knee joint is gradually damaged. Usually arthritis comes at the age of 60 to 70 years of age. But if a person has ACL ligament injury in his young age, in his 20 years or 30 years of age, he may develop arthritis in his mid-30s or mid-40s. That is a very bad complication of an ACL ligament injury. So it needs to be addressed and needs to be treated very soon as possible. What is the treatment of ACL ligament injury? The treatment, if it is a sprain, ACL sprain, or if there is a partial tear, then by ice packing, by giving rest to the knee joint can be treated. It can be treated by keeping it in rest. Physiotherapy, giving ice compress, giving rest to the knee joint can heal minor tears, or if there is partial tear of the ACL ligament. If there is a full tear of the ACL ligament, then these therapies do not work. We need to reconstruct the ACL ligament by using the hamstring muscles, that is the gracilis, the semitendinosus, or the patellar tendon, or the peroneus. By using these tendons, we do our ACL ligament reconstruction, by which we recreate the ACL ligament in the knee joint. After reconstruction of the ACL ligament, there is a rehabilitation procedure which is to be followed, and by around 3 to 4 months, the patient comes back to the normal life. And if a patient is athletic individual, if he is in active sports, the patient can join active sports by around 6 months of post-op. So this is how ACL ligament or anterior cruciate ligament injuries are taken care of. This is all about the ACL or the anterior cruciate ligament. If you have liked the video, please give a like and do share the video. And if you like my channel, please subscribe. So bye bye for now. Take care.